The government has released details about reform plans for healthcare charges, which are set to see fee adjustments for accident and emergency wards and other medical services. To ease financial burdens on patients with chronic illnesses, the government will introduce a cap on some charges with fee waiver mechanisms. The fee revamp will be implemented in phases over 5 years, starting January 1st, 2026 at the earliest. The latest details about the fee reform were unveiled by Secretary for Health Professor Lo Chou-Mao and Tony Ko, Chief Executive of the Hospital Authority, at noon today. Among them, the Accident and Emergency Department will be charged according to 2 tiers depending on the patient's condition. Critical and emergency cases will be treated free of charge, while the rest will be charged $400, more than double the current fee. The cost of general outpatient clinics is set to rise from $50 inclusive of medicine to $150 per visit. Patients will pay an additional $5 per drug prescribed, with no more than 4 weeks' worth of drugs dispensed each time. For specialist outpatient clinics, rates for the first consultation and follow-up session will be $250 and a fee of $20 for each type of drug, with the period of prescription maximized at 4 weeks. As for CT scans, MRI, and pathology tests, they will be charged a maximum of $500, while ultrasound examinations will cost $50. The fees are waived for emergency cases. Increased service fees too at geriatric day hospitals for the elderly and general community nursing services, while psychiatric day hospitals will offer free services. The government will put in place an annual fee cap of $10,000 per patient, excluding self-financed drugs, to help about 70,000 patients with chronic or severe diseases. The government estimates the fee revamp will generate an additional income of $3 billion per year.
This is to provide another protection for all Hong Kong citizens who may or may not be eligible to apply for medical waivers, but we will assure them that under this public subsidization reform, they would not be required to pay an amount that is unaffordable.
Past experience showed that after this kind of fee structures reviews, a certain percentage of patients, in particular the category 4 and 5 patients, they are more inclined to see alternative methods of care. This is very important because this enables us to have more capability to reserve our manpower resources to take care of the patients who really need emergency, accidents, and urgent care.
The government said the fee reviews will be undertaken again in 2028 and 2030.